Medicom-mtd, Taganrog, Russia, presents a system for polysomnography based on electroencephalograph recorder Encephalan EGR 1926, version 80 PSG video with electrode system EG11. Patient transceiver recorder in the cover back on the belt with electrode system connector and additional sensors. Two sensors of respiration effort, thoracic and abdominal, wireless body position sensor, snore sensor, pressure airflow sensor. Cannula is attached in nasal passages. On the patient's head there is a fixing cap with set electrode system ES11, 12 EG channels. On the legs of the patient you can see myographic electrodes for movement activity record and wireless movement sensors. On the upper arm of the patient, there is a wireless module of pulse oximeter with a sensor on the finger. Signals of wireless sensors are transmitted via Bluetooth channel received by APB and integrated into general data stream to personal computer. Patient supine. Sensors are additionally fixed with elastic bandage. On the patient's face, there are two sensors of electrooculogram and two myographic sensors on the chin. The electrode set of Encephalan contains fixing elastic cap with removable electrode system. Color markers of electrodes and electrode locks ensure simplicity of electrodes attachment. Electrode locks are made of elastic material, which increases patient's comfort at continuous studies, especially during sleep. Using the injection syringe without syringe needle, insert the gel into the slot of every electrode to ensure good quality contact of electrode with head skin. In the impedance check window, you can control electrode impedance. As the gel is being inserted, impedance in CZ derivation decreases. After successive filling electrodes with gel and impedance check, put on the covering cap, which ensures additional fixation of electrodes and prevents gel from drying out during continuous studies. EMG electrodes are attached onto the chin protrusion and 2 cm lower in projection of sublingual area, fixed with adhesive plaster. EMG signal is recorded in bipolar way. Left EOG electrode is attached 1 cm lower the left eye corner, right EOG electrode 1 cm higher the right eye corner, fixed with adhesive plaster. EOG signals are recorded in relation to contralateral reference. ECG electrode is attached into pericardial area. In the impedance check window, you can control electrode attachment. Execution of standard scenario. Patient with his eyes closed. Patient with his eyes opened. The autonomous transceiver recorder ABP with wireless control of stimulation via Bluetooth channel is used to carry out functional tests with photophonostimulation in telemetric mode. Photostimulation can be carried out using the integrated LED matrix. The LED matrix is set at a distance of about 25–30 cm and held in front of the patient's eyes. Photostimulation can be also carried out using the LED flash tube connected to the stimulator. Tube is placed in front of the patient's eyes and fixed by the cap. Now we carry out photostimulation with different frequencies according to the scenario. Then connect headphones to the stimulator for phonostimulation. Put the headphones on patient's head and carry out phonostimulation according to the scenario. Functional test with hyperventilation. Deep breathing during 3-5 minutes. Scenario in automatic or manual mode allows setting markers according to the timer. Hyperventilation the first minute, hyperventilation the second minute, etc. General view of the system with wireless module PG ECG. Module cooperates with ABP via wireless Bluetooth channel. Module supplements the system with 4 channels for record of respiration parameters, rear pneumogram 1 channel, and ACG by 3 derivations. There are connector slots for wires with touch-proof connectors and with color marks for ACG leads identification and places for electrodes attachment. Let's look through the test record of PSG study parameters. Signals according to the montage are displayed on the screen. The video monitoring window is opened. Video data are synchronized with the marker of the current time position. 12 EEG channels allow analyzing the background pattern, intensity of alpha activity, and rhythms of other frequency ranges, identifying EEG events typical for sleep stages, such as vertex waves, complexes, alpha spindles, and also detecting the epiphenomena. Patient turned his head to the left, closed his eyes. Alpha activity in occipital parietal area is dominating. Eyeball moving when the eyes are closed. To the left, to the right, up, down, look straight. Eyes are open till alpha activity synchronization. With eyes opened to the left, to the right, up, down, look straight. Blinking. Patient closed his eyes, pursed eyelids, myogram response. Patient set his teeth, myogram response. Patient did several swallowing movements, response on the submental EMG channel. Hyperventilation. Deep breathing is accompanied by increase of signal amplitude in thoracic and abdominal respiration channels, in the channel of airflow by pressure, in rear pneumogram channel. Patient is holding his breath, imitating central apnea. There are straight lines in the channels of thoracic abdominal breathing and airflow by pressure. Snore imitation with response of chin EMG. One more time. Breathing management. Limbs movement. Response in EMG channel of legs muscles and in channel of wireless movement sensors. Limbs movement in knee joints. Patient turns onto the right side. General movement of patient's body with response in all the channels. All recorded signals quickly restore their quality. Limb movement. Movement of a patient's body. He is turning supine. All recorded signals restore their quality. Patient turns onto the right side. Breath holding. There are straight lines in the channels of thoracic abdominal breathing and airflow by the temperature on the rear pneumogram. Snore imitation with response of chin EMG and EG channels. Breathing management. Breath holding. Snore imitation. Breathing management. Limbs movement. General movement of patient's body. He is turning pronate. Response in all channels. All recorded signals restore their quality. Breath holding. There are straight lines in the channels of thoracic abdominal breathing and airflow by pressure. Snore imitation. Chin EMG response. Limbs movement. Decrease of oxygen saturation to 93% in pulse oximeter channel. Movement. Patient turns supine. Closes his eyes. All recorded signals quickly restore their quality. Modulated alpha activity in occipitoparietal area is dominating. Eyes are closed.